Dr. Michelle Stafford here with World of Smiles, and we're here today for another podcast. And I'm here with my neighbors from Advanced Dentistry, a couple of prosthodontists. So I think we better start out with Dr. Halmos and Dr. Manning. You have to explain what exactly is a prosthodontist.
Well, it sounds a little like a dinosaur, but it's not.
Yes, it does.
Although a lot of what we do certainly stems from kind of going way back in the day to when dentistry was really becoming really popular, especially with dentures. So what we do as prosthodontists, in the simplest terms, is the prosthetic replacement of missing teeth and tooth structure.
Great, I like it. Can you be more specific for our audience on what that means, though?
Right, because
the non-dentists out there.
I would imagine a lot of people think, well, isn't that what a regular dentist does?
Right.
So it makes us different as prosthodontists from regular general dentists. And I think the way to answer that is, so we specialize, like Dr. Manning said, in the restoration and replacement of teeth. But oftentimes what we do is the small percentage of patients that require things that are a little more complex and somewhat out of the ordinary compared to what a general dentist may see as routine. So that includes things like seeing patients with congenital issues, seeing patients with a large number of missing teeth where it's more complicated to rebuild their bite and rebuild the tooth structure and the aesthetics and the function of the patient, bring the speech back. Anything from dentures to veneers, full mouth reconstruction of patients.
Great.
Things of that nature.
Yeah, very aesthetic. And I have to say, firsthand testimony over here, my dad, years ago, his front tooth crown had a problem, and I was like, oh, Dad, guess what? My neighbor, Dr. Halmos, across the way, is going to take care of that front tooth for you because there is no way I'm going to touch it.
Right.
And it still looks great to this day. Gosh, I think it's probably been 10 years.
It has. I can't believe it's been that long, but you're
since
right.
you fixed his front tooth. And
Right.
so we've been neighbors for a long time. Dr. Halmos and I go way back. We opened our practices the same year, 2008. Did you start in early 2008?
Right.
And then I started mid 2008.
Yeah.
And
then the party really happened when
Yes.
I came on in 2015.
that's right. And that's when the fun began.
Yep. Yep, that's true.
I can't believe it's been so long.
It's been a long
That's
time.
wild.
Yeah.
Time flies when you're having fun.
Over
right?
10 years now. Mm-hmm.
Yeah. And
Yeah,
now we're
pretty
doing
great.
this.
So,
And it's nice to hear the dentistry has survived a decade in your father's case.
yes, yes, one would hope, right? So, what changes have happened in your practice or with prosthodontists in the prosthodontics?
Right.
Well, I would say one of the
It's
biggest
lost 10 years.
changes that even like the American College of Prosthodontists, which is like our national society, is really starting to push digital dentistry. And not just with x-rays and things like that, but actually making intraoral scans or impressions where you don't have to have the goop in your mouth.
Oh,
which is,
so no more of that like trays with a big goop in there that kids love.
Exactly.
And grown-ups too, they love it.
Yeah, nobody wants to gag when they go to the dentist.
Yeah.
So that's one thing that I think is really changing recently. And then we're actually making things digitally as well. So there's computer-assisted design of whether it's dentures or crowns or veneers or a lot of the things that we put in people's mouths to replace either the tooth structure that they've worn down or the teeth that they've lost or weren't born with to begin with. And so it's really kind of cool to see how the whole landscape of how we do dentistry and prosthodontics specifically is changing.
Oh, that's so interesting.
Yeah.
Compared to where we began with, where we would see patients and everything was, the office was full of paper and everything was paper-based. And then a lot of the techniques that the laboratories would use to make us the prosthetic parts we use were techniques that were developed, 100 years ago. And so now, for years now, we've had a paperless office, as you have as well.
Yep.
And so paperless office, digital x-rays, digital photography, digital scanners. So everything's really moved into the digital realm, and it's changed the way we practice. And I think all of it has been for the benefit of the patient. It's less painful dentistry, faster treatment, solutions, and better outcomes. So a lot's changed in just 10 years.
Yeah, that's pretty great.
Yeah.
And if you had to talk about just one thing that you just love doing, if you're like, this is like the best thing, I love it.
Do I have to choose one? That's why I went into pros.
I know, it's true. That's a good point. Right. I think both of us agree. One of the things we like is the variability. You know, we don't just do 3 procedures kind of continuously, but we do a bunch, and I think it's one of the fun parts of the job.
I would say probably if I had to choose 2.
Okay.
Because I think
All
that's
right,
probably more reasonable. I really enjoy a lot of like kind of rejuvenating someone's smile, right? So a lot of stuff in the front where either they don't like the color of their teeth or the shape of their teeth or whatever they don't like about their smile, being able to improve on that, I think is a lot of fun. And then the other thing I think that's kind of in our wheelhouse in a way is a lot of patients who are either missing a lot of teeth or have a lot of problems with their teeth or grew up not necessarily with knowing how to take care of their teeth, and now they're older and want a more permanent solution, kind of removing the teeth and replacing them with implants and an implant bridge. It's really cool to watch someone, their whole personality changes. They go from this person who covers their mouth when they speak or doesn't really come forward in social interactions to when they come back, they're like a different person, and they've like taken life by the horns and are like outgoing and want to do all the things that they were a bit of a social recluse because of their teeth. And so doing that, I think that's probably one of the, at least my favorite things. What about you?
Definitely. That's
great.
Definitely some of the most rewarding stuff. I think a lot of people can imagine their grandparents living with dentures after they had to deal with them, because 50 years ago that was the common way that if the teeth were no longer viable, you'd remove the teeth and you'd be stuck with dentures. Now we have so many more options to help those patients out that they come in with that feeling of, I think my teeth are in bad shape, I think I may need dentures, and suddenly we give them an option that's so much better than that, and their confidence comes back, their function comes back, and I think they get a new lease on life, and extremely rewarding to do that for people.
Oh, that's really great. Yeah, I can imagine that must be really rewarding. I'm just picturing patients leaving your office and really kicking their heels up in the air.
I think as dentists, I think we went into this profession thinking that we're going to just fall under the reputation of dentists, which has been okay. I mean, I think we've been considered, as far as professionals go, very trusted individuals, right? Dentists in general, and so that's great. But everybody knows it's not their favorite place to be, and I think we've received.
People love coming to us, right? It's not like we hurt them at all.
Right.
It's not like they leave with like their mouth feeling puffy.
Right.
It goes away, but
yeah. But I think we've received more than our fair share of hugs and grateful patients because of what we're able to do. At the end of, sometimes it is a hard road, but at the end of it all, I think everybody agrees it's worthwhile, and to keep patients away from dentures for the rest of their life is a noble pursuit as far as I'm concerned. Yeah.
Wonderful. Oh, great. Well, thank you both for being here and explaining a little more about prosthodontics and what that is and being great neighbors.
Yeah.
I love having you guys across the hall.
Looking forward to the next 10 years.
Thank you. Looking forward to it. I love it. All right.
Yeah.
All right. So thank you, audience, for joining us for another podcast. Have a great day. Bye.
Bye.
Now let's record it.